both now and in the future, perhaps watching this on YouTube. I'm going to be talking about the gut-brain connection in Parkinson's disease. Um, let's see, I'll click here then. So we'll talk about the gut-brain connection, GI symptoms of Parkinson's, management of those symptoms, gut-related concerns of medication management, and dietary considerations. We may get a little bit into the nitty-gritty, so please forgive me, but I'll try to kind of place things in a broad sort of what do you need to know approach. So the literal connection between the gut and the brain is called the vagus nerve. Vagus from Latin for wandering, not related to Las Vegas, of course. And what you'll notice if you can see closely enough on this diagram is that the arrows go both ways. So if we start from the top and we look at that purple area of the brain, which is called the limbic system, we know that that's what processes emotions and stress. So in situations of high stress and difficulty coping with stress, the signals that can get sent down to the gut via the vagus nerve involve stress-related hormones and other neurotransmitters that can actually affect the gut microbiome. Conversely, or sort of in parallel, the changes in the gut microbiome can cause or lead to changes in processing of food contents in the gut, affecting the metabolites of those food products, and then subsequently affect different molecules such as fatty acids, 5-HT precursors, GABA, and then go back up the brain via the vagus nerve. So when we use that term microbiome, or underneath here it says microbiota, that's referring to the collection of bacteria and viruses and to a lesser extent fungi that are in our body in general. Actually, for our entire body, the number of cells we have more foreign cells like bacteria and viruses than we have human cells in our body. So we're just walking around teeming with germs. Normally, a very important part of our functioning. And then the gut microbiome is specifically related to, of course, the bacteria and other bugs in our gut. The bottom line there of cells is the intestinal wall. And you can see that things cross through in both directions there in a normal setting. So when we have people asking us if Parkinson's starts in the gut, there's various points of data that argue that it may indeed start in the gut. So one theory is that changes, and again, this image, you want to kind of look from the bottom up. So on the bottom in yellow, it says changed microbiota. Again, changes in the gut bacteria affecting the way food is metabolized. So bacterial products and toxins affect the sort of the intestinal wall, which is this line of gray cells above it, which can cause immune dysregulation, inflammation, what's called leaky gut, changing the way the various chemicals like cytokines are produced and levels of those, and can actually affect the protein alpha-synuclein, causing it to misform and clump together within the gut itself. And then from there, going over to the left side of this screen, you can see that those abnormal clumps of alpha-synuclein can travel up the vagus nerve to the substantia nigra. And people with Parkinson's, some of you may be aware, the protein that it causes Parkinson's is this abnormal clumping of alpha-synuclein that then subsequently causes the death of the brain cells, starting in the substantia nigra, but also going elsewhere in the brain, sort of spreading throughout the brain. So it's, again, important to note that we rely on our gut microbiome to properly process our food. So when we talk about bacterial products, partly that's the normal products. And then we see that with shifts in the microbiome, the types of bacterial products and metabolites can become toxic. The data behind of this is that alpha-synuclein deposits can be seen in the gut years prior to the development of motor symptoms of Parkinson's disease. Um, there are various bacteria that have, and I should say bacterial species that have been identified as being more likely to be increased in people with Parkinson's and more likely to be reduced in people with Parkinson's, the balance of which can result in, what's called leaky gut, reduced short chain fatty acid production, inflammation, as I mentioned earlier, increased formation of toxic alpha-synuclein type, and increased clumping of alpha-synuclein. Again, as I said, in both of those, that can go up to the brain and cause Parkinson's. The key thing about the inflammation here is, again, we're talking about over the decades prior to the development of Parkinson's disease. I like to think of the development of neurodegenerative diseases, including Parkinson's, but not limited to Parkinson's, as the outcome of, or the aftermath of, decades of fights between armies of good and evil within the body. And so inflammation is an example of something that the body is spending time clearing out or dealing with inflammation over the decades. And as it's fighting inflammation, there's fewer armies left to fight off the development of neurodegenerative diseases, like these, abnormal forms of alpha-synuclein, things like that. So these won't necessarily be symptoms that people may have identified prior to the development of Parkinson's. In some cases, we may see more commonly inflammatory bowel diseases, not universally in Parkinson's, but a little bit more commonly. But the concept is that it lessens the body's ability to fight off neurodegeneration. Other data for supporting the evidence that Parkinson's may start in the gut. Just looking at section B here, we're looking at the amount of time it took mice to cross a particular threshold in an experimental model. And so these black bars are the sort of the normal state of normal microbiome of a mouse model. And the very one all the way on the left that says WT, that's wild type. So this is a normal mouse. It takes, let's say, 5 seconds to cross. But when they introduce a Parkinson's model, it took them 8 seconds to cross. You'll notice in the white and blue that these were mice that were subjected to a germ-free environment or extremely high doses of antibiotic. And in both of those cases, even when they gave the Parkinson's pathology, they still remained fairly normal. So they still crossed kind of similarly to the normal mice. And then when they gave the mice the microbiome from Parkinson's patients, again, the Parkinson's modeling caused them to look like Parkinson's mice. So differences were noted not just in motor function, but also in alpha-synuclein inclusions and immune activation. Another study also pointed in that direction, also in a mouse model. They gave pathological clumped forms of alpha-synuclein called fibrils, injected into not the brain, but the small intestine of the mice. And the normal mice, the abnormal alpha-synuclein traveled up the vagus nerve to the brain and caused them to have a Parkinson's appearance. But the mice who were treated with vagotomy, meaning cutting the vagus nerve, those fibrils did not go up to the brain and they did not have any Parkinson's symptom. In humans, vagotomy is associated with a lower risk of subsequent Parkinson's. And again, this would be vagotomy done for very serious ulcer disease and not done experimentally as a goal to reduce Parkinson's, but they found epidemiologically that the people who'd been given a vagotomy were noted to have a lower rate of developing Parkinson's subsequently. So keep in mind, of course, that Parkinson's is associated with a slowing of the gut function, which can alter the gut microbiome. So it's a little bit unclear what's the chicken versus the egg here in terms of identifying a sort of a standard, or not a standard, but like a typical abnormal microbiome in Parkinson's patients. Patients who are taking medications may alter the microbiome itself. So it may be unclear whether it's the drugs or the disease that cause the abnormal microbiome. And the consensus opinion is that Parkinson's doesn't solely begin in the gut, that it can also begin in the olfactory bulb behind the nose from breathing in, toxic chemicals, for example, and can get spread to the brainstem unrelated to whatever's going on in the gut, or perhaps in conjunction with whatever's going on in the gut. So there's sort of two different avenues that Parkinson's may begin in sort of more common cases. And of course, if there's a genetic cause, that might change how Parkinson's begin. So not all Parkinson's is the same. The way the Parkinson's pathology gets in and spreads can be different from patient to patient. So this isn't a single, oh, we found this one thing that causes Parkinson's in everybody. It's very multifactorial. The another kind of element here is what's called small intestinal bacterial overgrowth. I'm seeing some dots on my screen. I've never seen that before. If somebody could try not to do that, you're adding to my screens, my slides, interestingly enough. Okay, so small intestinal bacterial overgrowth is found in 25% of Parkinson's patients compared to 15% of healthy older adults. In Parkinson's, it's associated with a worse motor function. Common symptoms are bloating, abdominal pain, excessive gas, and diarrhea, but less commonly nausea and constipation. It has to be diagnosed via breath testing, which is actually more complicated than it sounds. And that's done by a gastroenterologist. And it's treated with specific antibiotics and temporary dietary restriction. So because this entity exists, it's important not to start antibiotics or probiotics without guidance from a doctor. It's important for people who are experiencing these symptoms to make sure they've ruled out small intestinal bacterial overgrowth, because of impacts not only on motor function, but also on medications potentially. So what does this all mean for somebody who actually has Parkinson's disease? Well, people, after that study came out about the vagotomy, people asked me, oh, should I get a vagotomy? Should I go get my vagus nerve cut? Well, it's pretty high risk. It can cause diarrhea and delayed gastric emptying, and it's very likely too late to be effective for people with Parkinson's disease. We certainly don't have a really consistent enough way of predicting who's going to get Parkinson's definitively, even with genetic information, to recommend vagotomy for anybody who's at risk of Parkinson's. So we're not recommending that. People will ask me about probiotics all the time. And there's a little bit of data for some probiotics, specifically Lactobacillus and Bifidobacterium, especially with fermented milk, was shown in randomized controlled trial to help for constipation. There was one randomized controlled trial that showed improvement in Parkinson's motor scores, like how they were functioning. There's one probiotic that's being marketed quite assertively, called PS128, but it actually doesn't have randomized controlled trial data. In open label studies, it did show benefit in motor symptoms, and there have been some mouse models that showed plausible reasoning for neuroprotection and anti-inflammatory benefit. So, still, again, remains to be seen. Really be careful, because some probiotics will contain bacteria that can inactivate levodopa. If somebody has SIBO, the probiotics are not always the right way to go. So it is something that people have to be careful about. And some commercial products, I mean, the probiotics don't even last very long. So, you have to be careful with that. But it is very important for, if somebody has SIBO, to have that treated. And we'll talk more about a high fiber diet. People ask me, not so many people, but some people ask me about fecal microbiome transplantation, FMT. So what does that mean? So it's this idea that, well, if the gut microbiome is not normal in people with Parkinson's, can we reset or replenish the microbiome by literally getting a transplant from a healthy donor? And yes, that involves actually taking stool from a healthy donor. These are done very specifically in terms of testing, making sure that no bad bacteria or viruses, like COVID, for example, are being implanted, measured, checked correctly, et cetera. And then they actually find a way to deliver it orally in some studies. In this particular study that I'm showing you here, it was delivered via a nasojejunal tube, meaning they had to have a tube placed. This was a single FMT study. There was another study that was looking at an oral pill, like I think it was like twice a week for 12 weeks kind of thing. So this particular study, they were looking at a small group of people, half of which got the actual microbes and half of which received placebo. There were some mild, like temporary abdominal discomfort as far as side effects, and that was true in the other trial as well. But at the 12-month mark, and again, this was a single treatment, but at 12-month, the people who received the FMT were improved. And I'm sorry for, I've never seen this before, these sort of blue lines somebody drew on my screen, so I'm sorry if that makes it hard to read, but if you look at the top where it says B, the both groups improved at 3 months, but the improvement was greater in this red line, which was the people who actually received the fecal microbiome transplantation. So they had about a 6-point improvement in their motor scores at 12 months compared to the other group that also still were better than they had began, which is actually very interesting, even though they only received placebo. Again, pointing out that that's a huge placebo effect. Like, that's why when I was talking about that probiotic study that was open label, it means everybody knew they were getting the drug. So you get a fair amount of placebo effect, believe it or not, in Parkinson's. So, but still, again, significant improvement compared to placebo. On the bottom here, it's looking at essentially a marker for constipation. Colonic transit time is how long things take to move through the gut, kind of obviously. And the people who received the fecal motor transplantation, I said motor, excuse me, fecal microbiome transplantation had an improvement of like about half a day over the people who received the placebo. So moving on to gastrointestinal symptoms of Parkinson's, commonly constipation, including slow transit constipation, sphincter dysfunction, delayed gastric emptying, which is depicted at the bottom here on the right, where normal gastric emptying, things will move in a normal amount of speed through the stomach. And people whose stomach is not emptying quickly enough into their gut, there's more food in the stomach. They feel bloated. They feel full too early. They can only eat, half of their normal meal. And that we'll talk about testing and management in a moment here. Dysphagia, trouble swallowing, very common gut symptom of Parkinson's. Drooling due to reduced frequency of swallowing, low appetite, all of these. And actually what I didn't mention up here was it's called dysgeusia. It's a loss of taste or an abnormal taste because of loss of sense of smell in Parkinson's, and that also can impact appetite. So how do we evaluate GI symptoms? Again, it depends on the symptom, but the evaluation may include a swallow evaluation, which is typically done in conjunction with a speech therapist. Endoscopy and colonoscopy can be important to rule out a structural cause of symptoms. The image on the right is looking at how we measure colonic transit time, where the person was asked to swallow something that had these X-radiopaque, meaning like that you can see it on X-ray, and elements of it. And you can then measure how long it takes for things to go through the gut. You can actually literally quantify how quickly the gut is moving. And that's called colonic transit time. Similarly, almost the same concept, except they're doing the X-rays more kind of quickly in succession, is the gastric emptying study. You're swallowing something, take a number of X-rays, every 10 to 15 minutes and, see how long it takes for things to get out of the stomach. And then a consultation with a registered dietitian can be very helpful. So how do we manage these symptoms? Again, depending on what the symptom is, For swallowing issues, a huge, mainstay of treatment is swallow therapy, which is considered part of speech therapy, actually. Some people, unfortunately, will require a dysphagia diet, meaning, let's say, pureed foods or thickened liquids, depending on what the actual swallow evaluation shows. Often we'll advise patients to take smaller bites, smaller sips, to alternate between liquids and solids, to
What
do
was that?
double, a double swallow, or sort of like a deliberate, an
Who was
extra.
that, Tony?
uh, Allison, can you?
You don't know. Yes, you do.
Unmute
Thanks,
yourself, Dr. Petrossian,
thanks,
please.
thanks. Can you guys hear me?
Yes.
Okay, great. Okay. Make sure to eat only upright, chew slowly. And I guess I would also say be mindful, don't be like, talking and chewing at the same time, but just really being mindful while chewing and swallowing, kind of being more deliberate while swallowing. And then sometimes people will sort of deliberately cough to clear things. And of course, avoiding high risk foods such as whole nuts, dry crackers, pretzels, and tough meats. Again, this is if somebody has swallowing issues. This isn't necessarily true for everybody with Parkinson's. Constipation is very common and very important to manage. It's very important to bear in mind that constipation isn't simply a minor annoyance. It's actually really not good for one's health to be constipated because, of course, we know about the association or causing, rather, I should say, hemorrhoids and diverticulosis, but it's also associated with an increased risk of colon cancer, and constipation can definitely impact the uh, absorption and efficacy of the Parkinson's medication. So this is something that's very important. Plus, people just feel better when they're not constipated. So dietary options: prunes, kiwi, flaxseed, chia, bran, etc. But if all of that's not working, then Docosate 100 milligrams once or twice a day. Miralax can be as little as half a capful every other day or a full capful twice a day. Delcalax oral or suppository or Senna is needed. Water, super important. Exercise, even just going for a walk, very important for managing constipation. So to talk about fiber, there's two different types. There's soluble and there's insoluble. So soluble fiber can reduce constipation and blood glucose and helps with digestion, but insoluble would work a little bit better for constipation. Psyllium is a combination of soluble and insoluble fiber. It's not highly fermented. A lot of foods that have added fiber, like fiber bars, they have inulin or dextrin, which is a fermented insoluble fiber. And that can often cause a very significant amount of gas, especially if somebody's not used to it. So you kind of have to be careful with the fiber in terms of kind of monitoring the symptoms of that. We'll talk more about fiber in a moment, but key point is if somebody's on a very low fiber diet and they have a sudden adjustment to a really high fiber diet, it can be really hard as far as gas, abdominal pain, bloating. So you really have to go gradual with fiber. You don't want to just jump to like having all of the fiber. So be careful with that. Uh, and again, I said it once before, I'll say it again, water and exercise, because, often people just really aren't drinking enough water and they're just not walking enough. And that's really a big part of constipation. So when none of that worked and they're still struggling, that's when I'll make sure that they're seeing a gastroenterologist for sure, to make sure that we're not missing some kind of structural problem, but also to talk about prescription strength gut motility medications such as Linzess and Amitiza. Okay. Oh, sorry, clicking on the wrong thing. So if somebody has delayed gastric emptying, this can be managed with blenderized food. Domperidone, which is not available in the United States, erythromycin, but unfortunately people should not be given any metoclopramide, which is the more common treatment of gastroparesis or delayed gastric emptying. So that's off the list there. And then if somebody is drooling, we typically can treat that with botulinum toxin injection to the salivary glands or glycopyrrolate. So how the relevance with gut microbiome impacting levodopa absorption is very, very interesting. So this gray line we see here vertically is the blood-brain barrier. So what's on the left is the peripheral system. So, you know, the blood and the gut. And then on the right is what gets into the brain. So imagine what's on the right is within the brain itself. So we have a very important blood-brain barrier to keep out bad things from our brain, but dopamine cannot cross the blood-brain barrier. So if we want to improve dopamine levels in the brain, we cannot just give you dopamine. We have to give you levodopa, that L means left. So it's you know, actually you can see it up here. The difference between these two things is left-sided oxygen and hydrogen group. So point being is that you have levodopa, it goes into the brain, it gets converted into dopamine inside the brain, dopamine levels go up, and Parkinson's symptoms get better most of the time. However, if the levodopa gets converted into dopamine outside of the brain, meaning while it's still in the gut, then the dopamine can't cross into the brain, into the brain, excuse me, and dopamine outside of the brain can lower blood pressure and cause significant nausea. So with your levodopa is given carbidopa, and carbidopa blocks this enzyme, which is called dopa decarboxylase, so that the levodopa is not converting into dopamine outside of the brain. The levodopa can cross into the brain and get converted into dopamine only inside the brain where you want it. So not only does that improve the efficacy of the levodopa, it also reduces side effects. So when they first combined these two drugs, carbidopa and levodopa, their cute little name they came up with was Sinemet, which is sort of a bastardized way of saying without emesis, emesis being vomiting. So Sinemet, that's where that name comes from. It's supposed to mean that you don't have nausea or vomiting. Of course, some people will still experience nausea with it. That's a topic for a different talk. So unfortunately, gut bacteria, some gut bacteria, the ones that have this enzyme called TDC, excuse me, actually, it's a gene that, sorry, the enzyme TDC, the bacteria themselves can convert levodopa into dopamine in the gut, meaning that dopamine cannot make it into the brain. And the carbidopa that you take with your levodopa doesn't do anything for that. It does not block this particular enzyme. It only blocks this enzyme, not this one. So the these gut microbiome, these abnormal, let's say, call them bad bacteria, the carbidopa doesn't do anything to stop them from inactivating your levodopa. Unfortunately, that's something that can also be associated with longer term of Parkinson's and the prolonged use of levodopa. So those altered levels of gut dopamine impacting the GI motility can then cause these bacterial imbalances, not necessarily to the point of SIBO, but just the bacterial imbalances, resulting in worsening of the motor fluctuations, higher doses, and more frequent dosing, and then creating this sort of vicious cycle. So, you know, it's a very complicated thing, but it's very important to know that there are probiotics that contain these, let's call them bad bacteria. So, you know, be very careful. Not all probiotics are just like benign, right? So just to explain what this graph is showing, again, on the bottom, we're seeing the representation of the intestinal cell wall, and then the blood stream to get into the brain. So on the left is sort of what we want to see. The levodopa is absorbed and then crosses through the carbidopa is stopping it from being broken down. Levodopa is getting into the bloodstream, going up to the brain. And you can sort of see that ratio of like 4:1 levodopa to carbidopa. But in situations with high TDC gene abundance, meaning these bad bacteria, also, you know, seen in prolonged levodopa treatment, The increased bad bacteria, the increased TDC gene causes breakdown of the levodopa. So as you can see, really only a small amount of levodopa is crossing into that blood to get up to the brain. And then people are feeling like, why is my med not working? Or why is it wearing off too fast? Or why did it work yesterday and not today? And another kind of key point is whenever we talk about the gut microbiome, it's very important to know it's not static. It's not the same every day. If you get your gut microbiome tested, it doesn't, it's not going to always be the same. It varies with stress. It varies with how you slept. It varies with what you ate. So people will experience different efficacy of their medications. This one worked perfectly. Tomorrow I did everything the same and it didn't work as consistently. And that can be very frustrating to patients, but it most likely has to do with these changes in the gut microbiome. Again, as I mentioned, carbidopa does not help for that bacterial inactivation, but they did find an enzyme, an amino acid that can block that abnormal tyrosine decarboxylase. So that could be a potential treatment for managing motor fluctuation because it did make the levodopa more available. Again, so just to reiterate, what are the implications for somebody who has Parkinson's? As the GI symptoms progress, the gut slows down. It can impact the onset of action of levodopa. It can take longer to kick in. It's very important for levodopa to be taken on an empty stomach, as protein and potentially other food items in the gut can interfere with the absorption of levodopa. The medication should be taken at least 30 to 60 meals prior to having a meal. And when I say 30 to 60, for some people, 30 is enough. For others, it's not. They need 60. Not everybody experiences this. So it's more to do with people's experience of their levodopa. If they feel like it's working fine, they can keep doing what they're doing. I do have some patients who have nausea, who feel like they need to take the medication with food. And again, if they can, as they get used to it, as the nausea gets better, if they can slowly get to taking it on an empty stomach, that would be good. But it's one of those things where it really depends on the person in terms of how strict they need to be. But a lot of anybody who's experiencing motor fluctuations where they can tell it's wearing off, it's not lasting long enough, they really need to be very good about taking it on time and on an empty stomach. And then constipation should be treated aggressively. Again, as things are slowing down on the bottom, it's going to slow things down on the top. So what dietary choices are available? Well, there's good data for the MIND diet. The MIND diet has been associated with a lower rate of developing Parkinson's, as well as in people who are having a high fiber diet. They will have a better outcome with their Parkinson's. They will feel the difference. Maybe not immediately. It's less obvious as exercise. Like it's not quite as obvious, but eventually they will move better, walk better in the present, as well as we believe that it would help slow the progression of the disease. There's good reason to believe that. I mean, it's hard to prove these things. Dietary science, food science is, notoriously difficult to really be convinced of, because of, you guys are all humans, you're not robots, and we can't force feed you, cauliflower 3 days a week. So what is the MIND diet? It's the Mediterranean intervention for neurodegenerative delay. It requires or recommends, let's say, leafy greens, at least 6 servings a week, meaning like a salad, right? Other vegetables daily, berries twice a week at least, nuts 5 times a week, beans and legumes and lentils 3 times a week, whole grains 3 times a day, which sounds like a lot actually. So again, you just have to balance with what you can tolerate. Fish once a week, poultry twice a week, and using olive oil instead of butter as the main cooking oil. The MIND diet also recommends limiting the intake of sweets, butter, cheese, dairy, and red meat. also, and again, the dairy piece of it is a little bit, I would say, controversial. I think the key point is not that the dairy is the problem, but rather that people need to make sure they're getting those green leafies and other vegetables and the high fiber. And then, the yogurt could be part of that too. But it's not that yogurt is bad for you. It's just you kind of have to make sure you're balancing it with a high fiber and all these other things on the Mind diet. Other Parkinson's patients may have really specific diets that they need to keep for dysphagia, like, as I mentioned before, if they need to be on a pureed diet. If a patient is experiencing a lot of weight loss, they may need to adjust their diet to really be calorically dense. Some people with SIBO are advised to go on what's called a low FODMAP diet, which is a very challenging diet. Ideally should only be temporarily. And then patients with delayed gastric emptying or small bowel obstruction, they may actually need to be on a Blandr diet, or a blenderized diet, that kind of thing. So all of these things, mean that there isn't like a one size fits all Parkinson's diet. For people who have low blood pressure, they may need to, adjust their salt intake. And then some people have religious or other dietary restrictions, like needing to be gluten-free or what have you. It's very important to just try your best. You're a human, we are raised in a society, and I believe, if I'm not mistaken, that, pretty much every culture on this earth shows their love through carbs, so it's hard to sort of break that, but it's important to try your best. And a discussion with a registered dietitian may be necessary in some cases. So what's a high fiber diet look like? So for people over the age of 50, men should be having 30 grams of fiber a day, women 21. And people may think, oh, I have a salad, I'm definitely getting fiber. But I invite you to take a day or two and actually write down how many grams of fiber you're actually getting, because you might be surprised that you might not be actually getting as much as you think. Some of the key points about these, and again, this is not an exhaustive list. There's a lot of other things like, avocado and stuff that are not on this list. So, don't be offended by this list. It's just sort of like kind of what are the high producers, right? The most bang for your buck, if you will. Some of the key things are making sure that whatever you're eating is sort of, think about skin on. So apple with the skin on, pear with the skin on. And the same goes for wheat, right? So when we think about like white wheat products, they've sort of taken the skin off, if you will. They've taken off that husk where the fiber is. So, when we talk about whole grains like whole wheat, you get much more fiber out of them than white things. Again, same thing as I said when I mentioned the supplements of fiber is you want to be really careful about how you're increasing fiber. You don't want to go from being on a really low fiber diet to high fiber tomorrow, because you're likely to get abdominal pain. And then, why, again, just one more time, I don't want to like beat you over the head with this, but one more time, why is this important to be on a fiber-rich diet? It's because what we eat is feeding our gut microbiome. We get to choose what our gut microbiome is going to be like based off of what we're feeding. Kind of like if you guys have heard of like, survival of the fittest, or, not artificial selection, if you will. When we are feeding our gut microbiome fiber, we are selecting for bacteria that feed on fiber. Whereas if there's no fiber around, those bacteria will die off. And the bacteria that remain are the ones that enjoy feeding on mucus. Well, sure, mucus sounds like a bad thing, but actually mucus is very important for our gut lining. It's actually what coats our gut lining and keeps our gut lining healthy and prevents bad stuff getting into our blood via the gut, right? Because everything we're eating has, we're constantly being exposed to, toxins and carcinogens and things like that. And our mucus is what protects us from the outside world. So we want to keep a mature mucus layer, which is what you see in this sort of middle area with that healthy pink appearance here. somebody who's on a fiber-free diet, those bad bacteria, which are depicted in red, they're the ones who are like, having a party and taking over and like, woohoo, like, we get to feast on our host, which is our mucosal layer breaking down. And again, those gray cells on the bottom are depicting our intestinal layer of cells. And you can see that what the yellow things are called mucosal pathogens, meaning disease causing bugs. They're coming in and they're eating through into our gut, causing this leaky gut. So really, really, and again, this was from a study where they looked at mice, and they gave half the mice a fiber-rich diet and half the mice a fiber-free diet, and then they looked at their mucus layers of their guts subsequently. And they were actually given human microbiome. So, it's not just what mice microbiome looks like. So very, very interesting study. So the healthy diet, meaning, the MIND diet, the, fiber-rich diet, is associated with a healthier mucosal layer, but also increased BDNF, which is the brain-derived neural factor that has been shown to improve, or excuse me, to reduce the breakdown of brain cells, the death of brain cells, and it has been shown to reduce the spread of Parkinson's pathology in the brain. You can also increase your BDNF by exercise, so that's good news. And then it also is associated with improving levels of GLP-1, which is our important glucagon is important in neuroprotection as well, and short chain fatty acids also important in neuroprotection. So feed the bugs you want, or the bugs will feed on you. All of this needs to be taken in balance. We recognize that. Again, sorry that a lot of these pictures, you kind of have to start from the bottom up. So on the left, we see probiotics, prebiotics, meaning like feeding the bacteria with fiber, etc. The Mediterranean diet, and symbiotics, which is sort of a combination of those two. Like if you have probiotics with fermented milk or something like that. So the healthy diet options, and again, I would add in exercise and drinking water and working on stress management, all of that, adequate sleep, all of that also impacts gut health. So I would add that in if I could adjust it. I took this slide from a study. So that improves the gut barrier function, it reduces inflammation, beneficial bacterial growth, positive neuroactive metabolites, all within this gut, and then that spreads via this enteric nervous system up the vagus nerve, there's that vagus nerve again, to the brain, versus the Western diet or the standard American diet, very low fiber, lots of processed foods, junk food, etc., alcohol, and Parkinson's itself. Again, this is sort of this gray question mark, is what's chicken versus egg here. But these things contribute to pro-inflammation microbiome, immune dysregulation, and abnormal levels of gut microbiome, and increased intestinal permeability, which is a way to say leaky gut. And then things will go up again, back up through that vagus nerve. So alcohol, people ask me about this all the time. It used to be part of the MIND diet to have a glass of wine. I actually think there's good data that alcohol can negatively affect the gut microbiome. I'm all about moderation, because I'm not going to ask my patients to do something that they'll only be able to handle for a month or two, like some kind of extreme lifestyle options. So I encourage my patients who really enjoy that glass of wine to consider drinking only on the weekends instead of drinking every day, so that they're, still enjoying their wine on the weekends, but they don't need to have it every day. And of course, if somebody's drinking too much, then obviously they need to work on that, maybe see a therapist, maybe, AA, what have you. But, for most of my patients, they're like, well, I don't have a problem with alcohol, and they don't, but it would probably be better to drink less than more. Okay, so changes in the microbiome may play a role in the development of Parkinson's. Healthy choices with a high fiber intake, regular exercise, management of constipation, sleep, and stress can help balance the microbiome, and further research is necessary on probiotics and fecal transplantation. Thank you, guys. I'm going to stop sharing.